Good morning, everyone. We're going to give about 1 to 2 more minutes while we wait for folks to come on into the room. Okay, 1 more minute. We'll start at 9:03. All righty. Good morning, everyone, and welcome to our training today, where we are going to be going over CAS housing, the referral process, and also document readiness. And we're also introducing a new segment. We're also introducing a new portion, our survivor CAS system as well. That's also going to be included in this training. So you're going to get a lot of information, but that's totally okay because it's going to be recorded and these slides will be made available to you as well. So I don't know if any of you all noticed that you are muted. So because it's a webinar selection, you'll pretty much have to put your questions in the chat. And then everyone is on mute. So that's how this works for now. Also, yeah, so there's no camera and there's no mic as well. So you'll just only be focusing on myself, Talzeen, and Melissa, who will be hosting today's training. Okay, so if you have any questions, feel free to add it in the chat. We will be monitoring that as well. Okay, so we have about 26 folks in the room already. Awesome. But yeah, we can get started so that we can have more time for any questions that you may have at the end of the presentation. Okay, so I'll go first. Hi, everyone. I am Shaitra Ken. I am the program analyst, formerly the case conferencing specialist here at Sacramento Steps Forward. Melissa or Talzeen, would you like to go next?
Sure. Good morning, all. I'm Melissa Shelton, one of the referral specialists here at Sacramento Steps Forward.
Hi, everyone. I'm Talzeen Moro. I'm also one of the referral specialists here at SAC Steps Forward. And I'm sorry, for some reason, I think my camera was also disabled, but I can turn on my mic.
Okay, cool. Alrighty then. So without further ado, let's jump into the presentation.
Okay. So again, good morning all. We're going to go over our CAS housing and case conferencing training. Just bear with us. So I'm going to be introducing our CAS team members. We have Peter Bell, he's our planning director. We have Stacy Fong, who is our coordinated access manager. And we have Michelle Reedus, which is our coordinated access program manager. Peter plays a role as in plans and directs future operation and initiative for Sacramento Steps Forward in the larger community. Stacy, her role is she manages and oversees the operations within the coordinated access system. And Miss Michelle manages and oversees the coordinated entry system, or coordinated access system as it is. Shaitra is our program analyst. Congratulations, Shaitra. She just took on that role recently. She assesses policies and procedures of the Sacramento COC to provide and provides analyst services and recommendations for improvement. Myself, referral specialist, coordinating with providers for CAS housing referrals and placement, checks clients' eligibility, document readiness. Then we have Chris Athis. She is our survivor CAS program analyst. Her role is policy, system improvement, and process development projects and programs within the survivor coordinated access system. Also, we have Talzeen Murrow. She's one of our other referral specialists. She works with the providers from Standard CAS and the survivor CAS system to connect them with available SSF housing opportunities. Tiffany is back. Tiffany Rearms. I'm not sure if I'm saying that correctly. She's our case conferencing coordinator. She has worked with us before. We're happy to have her back. Her role is that she plans and coordinates case conferencing efforts with providers across the Sacramento continuum of care. What is coordinated access? A streamlined system designed to match people experiencing homelessness with housing and service options. The process prioritizes limited local supportive housing resources, so people with the highest vulnerability can be connected to support as quickly as possible. CAS goals, number 1, to increase the efficiency of the local crisis response system. Our second goal is to improve fairness in how housing and services are allocated. Our third is to facilitate rapid access to housing and services. What coordinated access is not. It is not a first come, first serve. It is not a backdoor or side door referral process. Direct referrals through a connection and not through coordinated access system. We always use CAS. Closed referral system, it is not. We are not able to take, your program specific referrals. We also don't believe in an opaque process. So unclear processes of how to obtain referrals and resources, we can't grant that as well. So this diagram kind of says it all as far as if you need a visual. Coordinated CAS, or coordinated access system, is a network designed to match people experiencing homelessness with shelter, housing, and service options. CAS helps connect people with the highest needs to housing and support services as quickly as possible. So it starts with 211, that's the access point. Then it goes to, which is triage, crisis response, shelter, outreach, DV or domestic violence, resource connection. Then we go to our assessment process, housing problem solving, shelter assessments, housing assessments, prioritization, which is our chronicity. 65-year-old plus is considered, and we consider the age. Number 3 is our chronic health conditions. 4 is the length of time homeless. And then our referral goes to housed. Why is CAS so critical? CAS connects people who are unhoused with critical resources and services, creates a pathway so people who are unhoused can navigate to the end of their housing crisis. Without system coordination, the community is limited in the impact we can make toward addressing homelessness. And number 4, the system empowers people who are unhoused and providers to have clarity and know the supports available. Coordinated access system. The 5 essential elements of the coordinated access system. Number 1 is access. Number 2 is assessment. Number 3 is problem solving. Number 4, prioritization. And number 5 is creating the referral. Number 1, access. To be considered for housing openings, individuals must connect with a COC housing provider to be prioritized for CAS housing opportunities. In Sacramento, individuals can access CAS by contacting 211 and pressing 8, very important, be sure to press that 8 to connect with 211 staff to discuss emergency shelter, housing problem solving, and housing resources. Individuals can also enter CAS through the following: street outreach, CAN navigators, and partner agencies. Number 2, assessment. COC providers associated with coordinated access begin assessing the individual's housing needs, preferences, and vulnerability. Phased assessments. Number 1, safety and security. Number 2 would be shelter survey. Number 3, problem solving. Number 4, VS-BDAT for individuals or families. Housing problem solving, homeless prevention, diversion, rapid exit.
And one more thing, so usually when we talk about housing problem solving for the diversion part, we're thinking more of like PSAPs and other programs that may help not allow your clients to go into shelter, or who were in previously housed, but now they're at risk of homelessness. So this is where this would be.
Thank you, Shaitra. So number 4, prioritization. During assessment, the individual needs and level of vulnerability may be documented for purposes of determining prioritization. Prioritization helps the COC manage its inventory of community housing resources and services, ensuring that those persons with the greatest need and vulnerability receive the support they need to resolve their housing crisis. Priority list schema. Number 1 would be chronicity. Number 2 would be 65 plus years and older. 3, chronic health conditions, and 4, length of time homeless. So number 5, referrals. 3 lists that affect priority eligibility. We have a by name list. All individuals experiencing homelessness that are in the Sacramento HMIS system, a community queue, VS-BDAT, and active services have been logged into the client within the last 90 days. Yeah, we want their VS-BDAT to be within 90 days of creating a referral. The priority list, AKA hot sheet, sent bi-monthly to case conferencing groups, which includes the top 1 to 300 most vulnerable clients. There can be multiple priority lists based on eligibility, and then the majority of referrals originate from a priority list. Number 5, referral adaptability, factors to consider for housing openings, types of housing. We have many types of housing: shared, roommates, site-based, scattered, etc. Non-COC housing / funding sources, behavioral health, connected to BHS county services, and property management. Additional eligibility factors not COC funded, additional applications process, subpopulation restricted, TAY, veteran families. Adaptability continued. To assist with making successful potential referrals, we suggest people go to case conferencing, look at phased assessments. We want to get all the HMIS data in HMIS as complete as we possibly can. Low barrier approach, data-informed decision-making, COVID prioritization, client voice, provider voice. We want to know how we can improve, please. We're always looking to improve. So now we're going on to case conferencing, which is our Miss Shaitra Ken.
Yeah, I've been in this role for a while, right? So I should know something about this. All right, so yes, let's talk about some case conferencing. All right, so what is case conferencing? Case conferencing is client care discussion held between Sacramento Steps Forward representatives and providers across Sacramento County, right? So these could be outreach workers, this could be county workers, this could be healthcare workers, this could be shelters, anyone who has access to HMIS and have clients they would like to discuss, definitely come to case conferencing. The purpose? To collaborate and provide community-wide support on a client's housing plans and other available resources, to create action plans and goals to house clients more effectively and quickly, and lastly, to stay updated on the housing openings and/or opportunities, trainings, and other resources that might be helpful for you as outreach workers and people who are working with our population. So what types of case conferencings do we have? So we have family, chronic, veterans, behavioral health services, transitional age youth, rapid rehousing. There also is going to be an access shelter coming up. So these are all bi-weekly or bi-monthly, right? So they happen twice a month and usually starting at 9 a.m. except for transitional age youth. So you can definitely look at these. And if you're ever like, oh, I don't know which case conferencing I need to go to, simply do the interest form and then we'll put you in our email group. And then you'll be able to get the emails for the upcoming case conferencing. It also tells you the date, the time, gives you the Zoom link, and also the latest priority list. And that's usually sent out every other week. Okay, so again, this will be the link to the case conferencing guide. So when you have access to this is actually fairly helpful. Here we are. And this tells you how to use the case conferencing tool. Whenever it wants to work.
It's thinking.
Thinking real hard.
Yeah.
And then it's not even working.
It's a little came up, I thought. There you go. Maybe.
Okay, well, that seems not to be working.
You can put it in the chat if you'd like. It'll open up for me.
I'm sorry, what?
I can put the link in the chat. It might work for providers better. It worked for me when I clicked on it.
Okay. Could you please? All right, let's see. Well, I want to show them how to do it. So maybe I'll just do a quick little. Okay, I'm gonna share my screen again because it wasn't working, but I can show you, we'll do it directly with it, so it'll make everything easier. Okay, so if you are in your HMIS profile, right, you need to make sure that you're in the Sacramento COC account when you make your case conferencing tool. And I will type up my client's name, or you can put in date of birth or the last four of the social, whichever one works best for you. All right, maybe it's just my internet. Okay, so here.
What if I share my screen, because and then
That's okay.
you can just discuss it?
I think it's fine.
Okay.
Thank you, Colleen. So we have mother test here, and you want to go to assessments first. And then in your assessments, you will have to find the case conferencing tool. So if one isn't created, you can just create one here. But you could also see if one was created in the past. So you can look down all over here and be like, oh, okay, I don't see a case conferencing tool. All right, so I need to create one. So you simply go to start. And then from here, you're going to input your information. So If you're the only one working with them, simply your agency and who you are and the date that you started working with them. You can toggle here which case conferencing groups that this client may pertain to. So behavioral health, are they connected to county services? Are they chronically homeless, meaning they've been homeless for 12 months or more? Or 4 instances of homelessness in the last 3 years? Are they a veteran? Are they in, are we considering them for rapid rehousing? Are they transitional age youth? Are they a family? And or were they in Project Room Key? So client history and housing barriers is actually fairly helpful for us to know what exactly may impact this client for getting housing. So it helps the referral specialist know what to consider. So does this client have a wheelchair or use a walker? Are they ADA? Are they amputees? Do they have, are they struggling with addiction of any sort? So any AODs? Also, do they have any evictions? Things of that sort that are really causing them to having or mental health considerations as well. And then here is your progress notes. So as a caseworker, these are very helpful. So say if you're working with the client and then you stop working with the client and someone else picks it up, they have all of these notes to be able to look back on to see what you've been doing with the client, to see where they can be able to help. So I definitely suggest that you do some progress notes as well. Engagement confirmed, right? So when have you connected with this client? And then also, I really love this part, step 2. So as an advocate for your clients, right, you know what kind of programs your client should be in. And so we also need to know what you as an advocate think is the best process for your client. So we have permanent supportive housing, rapid rehousing, voucher, and other programs. So it's best if you pick these because it also helps you know what type of documentation you need for them. And this case conferencing tool tells you. It's really, really cool. So if I have permanent supportive housing, we need to check off what type of document ready are they. If they have their ID, okay. Do they have their social security uploaded? Great. Do they have birth certificates of any minors? Awesome. Do they have their VI-SPDAT within the last year? Okay, great. Do they have their homeless cert? Awesome. Do they have their disability cert? Okay. Do they have the third-party verification that's needed for the chronic form? And then also, do they have the chronic cert, right? So this part, the third party goes in hand with the chronicity cert. And so if you have all of these, this will deem your client as document ready, right? So then we would click these two and be like, okay, they were document ready on this date. So this is pretty helpful for us to know if your clients are doc ready, and also to make sure that you as a provider are also on track to making sure your clients are doc ready. And so that's for permanent supportive housing, which has the highest level of documentation. And or if your clients are needing rapid rehousing, right? It does the same thing where it's like, it'll change it for you of what documentation is needed, right? And so remember that the birth certificate is optional. It's only if your clients have children. If they don't have any minors in the household, you don't need to toggle this. And if you have everything else, great. That means that they are doc ready. So this is a nice way of helping you as providers or new folks know, okay, what do I need to make sure my client gets into this type of program? And if your client is PSH doc ready, they are still eligible for all the other programs. So this is just the highest level of documentation. Okay. So then after that, we have step 3, refer to a program, potential program. So this will be done by SSF staff, so you don't have to worry about this part. And then lastly, step 4 will be done by you. So if your clients they've gone through the system and they're actually moved into housing, you have a move-in date set for this client, you're simply going to toggle this one and then put the move-in date here. So there are 2 places in HMIS that when a client is housed that you will put in a move-in date. That's at the program enrollment section and then also on the case conferencing tool. So this helps me be able to filter folks out of the priority list who are already housed. Okay, so doing both of those are very helpful. So yes, and also you're allowed to have more than one person working on this, right? So you may have one agency, for example, say it's Hope Cooperative is working with the client, and also this client is connected to Turning Point. I don't know. So then you will also have these folks here as well, or First Step Communities, because I'm like, oh, behavioral health and a shelter. Yeah, so then they can also be connected here. So this is a good way for you to help collaborate and help you get in contact with the client if they go MIA or anything like that, or you just need some extra help. Usually all staff usually puts who's working with them, and so you're able to contact them. And also the care team helps as well. Okay. All right, back to this beautiful presentation. Yeah, so that is our case conferencing tool and how to use it. I will work on the link. It sounded like you can access the link. I just wasn't able to access it today for some reason. Alrighty. Okay, so that is it for case conferencing. And now it's going to be Talzine's turn. I lied, I'm sorry. It is going back to
My turn.
Melissa.
Good job.
Thank you.
Talzine's like, uh-oh. Okay, so we're going to discuss our housing programs. So HUD definition of the homeless category 1 is category 1, literally homeless. Individual or family who lacks a fixed, regular, and adequate nighttime residence, meaning number 1, has a primary nighttime residence that is a public or private place not meant for human habitation. Number 2 is living in a publicly or privately owned, operated shelter designated to provide temporary living arrangements, including congregate shelters, transitional housing, and hotels and motels paid for by charitable organizations or by federal, state, and local government programs. Or number 3 is exiting an institution where she or he has residence for 90 days or less and who resides in an emergency shelter or place not meant for human habitation immediately before entering that institution. So this is your literally homeless category, category 1. So HUD definition, homeless category 4. Category 4, fleeing, attempting to flee domestic violence or DV. So if you're DV, that's domestic violence. Definition. Number 1 is fleeing or attempting to flee domestic violence, human trafficking, dating violence, sexual assault, stalking, or other dangerous or life-threatening conditions that relate to violence against the individual or a family member, including a child, that has either taken place within the individual's or family's primary nighttime residence or has made the individual or family afraid to return to their program nighttime residence. And number 2, has no other residence and also lacks the resources or support networks to obtain other permanent housing. HUD definition of at risk of homelessness definition. At risk of becoming homeless definition has an annual income below 30% AMI or area median income, does not have sufficient resources or support networks immediately available to prevent them from moving to an emergency shelter or into homelessness, is exiting a publicly funded institution or system of care, such as a healthcare facility or a mental health facility. And that's also to include meets one of the following conditions: have moved because of economic reasons 2 or more times during the last 60 days, immediately preceding applying for homeless assistance, is living in the home of another because of economic hardship, has been notified in writing that their right to occupy their current housing or living situation will be terminated within 21 days of the date of application for assistance. Due diligence needs to be done to confirm they will lose their housing without one-time financial assistance, such as eviction notice need to be provided. Lives in a hotel or motel that is not paid for by a charitable organization or by the federal, state, or local government programs for low-income individuals. Lives in a single room occupancy or efficiency apartment until more than 2 people, unit with more than 2 people, or lives in a larger housing unit in which there reside more than 1.5 people per room. Permanent supportive housing, otherwise known as PSH. Permanent supportive housing, again, otherwise known as PSH, is permanent housing in which housing assistance, such as long-term leasing or rental assistance and supportive services, are provided to assist households with at least one member, head of household, with a disability in achieving housing stability. The eligibility requirements, category 1 or 4, homeless, disability, chronicity. What is needed for a referral when you're looking for a PSH, permanent supportive referral? We want the VSPDAT, V2. Homeless certificate would be the second thing. Third is the disability certification. 4, chronic homelessness certification. With 12 months of experiencing homelessness verified, we would need a social security card, a valid ID, and then also if there's minor children in the home, we would need birth certificates and social security cards as well. And that again is only for the minor children. And then we're going on to permanent housing, PH. Permanent housing is a community-based housing model, the purpose of which is to provide housing without a designated length of stay. PH program participants must be the tenant on a lease or sublease, which must have an initial term of at least 1 year, be renewable for one minimum term of 1 month, be terminated only for cause. The eligibility requirements for this is any individual or family who currently are category 1 or 4, DV or homeless, at risk of becoming homeless. What is needed for a referral for permanent housing or PH? We want to complete a permanent housing assessment, at risk or homeless certificate or homeless certification, which we'll go into those things and what they look like here in a bit with the DV side of it that Telsey will explain to you. The social security card, valid ID, birth certificate, again, only for the minor children in the households. Rapid rehousing, which is RRH. RRH provides short-term up to 3 months and medium-term 4 to 24 months tenancy-based rental assistance and supportive services to households experiencing homelessness. The length of assistance is based upon the need and evaluated on a month-to-month basis. Eligibility requirements, category 1 or 4, homeless. So again, that's DV or homeless, or chronic homelessness. What is needed for a potential referral? We would want you to have a VSPDAT, V2 assessment, and the VSPDAT, we'd like that within 18 months of the assessment or of the referral being created, a homeless certificate, which never expires, or no, we'll go into that, ignore me. Social security card, valid ID, birth certificate, and we only need that again for the minors. And some RRH programs do work with clients to obtain these documents after the referral has been placed. So that would be between the provider and the caseworker. SHRA voucher programs, there's several of these. So Sacramento Steps Forward partners with SHRA to provide housing vouchers to low-income individuals and families to enable them to afford decent, safe, and sanitary housing in the private rental housing market. So the first one we're going to talk about is tenant-based vouchers. The housing subsidy is paid to the private landlord directly by SHRA on behalf of the participating family. The family then pays the difference between the actual rent charged by the landlord and the amount subsidized by the program. Shelter Plus Care, which is also known as SPC, they need to be enrolled in a behavioral health service. They need to meet PSH document ready, which is ID, social security card, homeless certificate, chronicity certification, and disability certification. Foster Youth Independence, which is FYI vouchers. That would have to be individuals between the age of 18 and 24, homeless category 1 and 4, at risk of homelessness, entered the foster care system after the age of 16. They need to meet the PH documentation readiness, which is ID, social security card, homelessness certification, and this is a limited 3-year program. And now we move on to Ms. Talzine for the Survivor Coordinated Access System.
Thank you, Melissa.
You're
Okay, so yes, I'm here to talk to you guys about SCAS, Survivor Coordinated Access System. Can you go to the next one? Thank you. All right, so what is SCAS? It is a confidential system for survivors. So in 2020, the Department of Urban Development, or HUD, awarded 2 rapid rehousing programs in Sacramento to funding to house survivors fleeing or attempting to flee domestic violence, sexual assault, human trafficking, and other life-threatening conditions. Since then, we have added 2 additional rapid rehousing programs, as well as a PSH, or Permanent Supportive Housing Program. As part of the award, HUD requires the COC to provide a safe and confidential access through the Survivor Coordinated Access System. And SCAS is aimed to be inclusive of all victim service providers and those with training and knowledge for how to best support our survivors in our community. So all of that to say is that SCAS was really provided to assist our survivors reach another level of confidentiality, to ensure that they have access to opportunities, or to additional housing opportunities, and also to ensure that they can be safe and in a confidential manner from their safety and the safety of the household. Okay. And so SCAS has 5 housing partners. So it's Opening Doors, My Sister's House, Shelter Inc., Lao Family Community Development, and Weave. Weave is the one that has the PSH program, and it has 9 units. And you can see the rest of the units breakdown here. Melissa touched on this a little bit, but rapid rehousing is a program that provides up to 3 months for short term and 4 to 24 months of tenant-based assistance for medium term. And then the PSH program, which is with Weave, is a tenant-based voucher and supportive services for families up to 2 to 5 persons, provided with no maximum term, and this has ongoing case management for survivors as well. And there are 6 essential elements of a survivor to navigate SCAS. And number 1 is confidentiality. Number 2 is access. 3, assessment. 4, problem solving. 5, prioritization. And 6, reform. Here are the eligibility requirements for SCAS programs. Clients need to meet category 4 of homelessness, which is fleeing or attempted to flee domestic violence, and has no other residence, and also lacks the resources or support networks to obtain permanent housing. And I want to also highlight that even though it says domestic violence here, it is inclusive of all the other groups that population groups that were mentioned in that category 4. Excuse me, so sorry. Okay, and then for permanent supportive housing, which is PSH, the client needs to meet, again, category 4 of homelessness. They need to be chronically homeless. They need to have a certified disability, income below 30% AMI, a valid ID, and a social security card. Okay, this is a current process to access our SCAS. So first, right here, the provider or a provider in the community will identify a survivor, and they will identify that this client needs survivor-specific resources. Then that provider will assist connect the client to a victim service provider access point. That access point, or VSP, establishes the eligibility, will administer prioritization questions and safety assessments for the client. From there, the VSP will access, the VSP access point will then add the client to our prioritized list to ensure that this client can also be considered for housing openings. And when an opening becomes available, we will use the priority list from SCAS to make referrals for those openings. Okay. Okay, and so these are some of our SCAS system goals. We are developing new prioritization and assessments to make sure that we can really capture and prioritize the most vulnerable clients, create pathways and processes for survivors to access services with non-VSPs, continue coordinating and triaging with central call line 211 and VSPs, increase accessibility to safe housing options for survivors, train staff on trauma-informed care and survivor-centered best practices. And I want to highlight the continued coordinating and triaging with central call line 211 and VSPs. We do acknowledge that there's not enough victim service providers in our community. And so we want to continue to find ways to connect the standard CAS and survivor CAS to allow our clients to access all of those housing opportunities available for them, and also doing it in a way that they can be protected and their confidentiality can be protected. If you have any additional questions or would like more information about SCAS, you can contact me directly. Again, I'm the referral specialist. And here is my email. And there's also Carissa Thies, which is our program analyst for SCAS. Okay, and now I'll talk to you guys about doc readiness, which, as many of you know, is very, very important for our referral process. There is two types of document readiness. The first one is PSH, again, permanent supporting housing. This is the highest level of documentation that we require for the program. So you'll see there's 5 to 6 different requirements. The first one will be the chronicity certification, which never expires. The disability certification, again, never expires. Homeless certification is only valid for 30 days. So this could be a challenge perhaps if that was uploaded in HMIS and it's been more than 90 days. But if the client is still eligible, that should be an easy fix. Of course, a valid or current ID, I really want to highlight on the current. Sometimes, you know, there's an ID that just barely expired, but we do need the IDs to be current and valid. Social Security card, and if there are any minor or dependents in the household, birth certificates as well. Now for PH, or permanent document readiness, is slightly easier with 3 to 4 requirements, and you need the homeless certification, basically certifying within those 90 days that the client is still homeless and in need of housing. Again, that valid ID, Social Security card, and if there's any minors in the household, birth certificate. So something really important to highlight between the two is the chronicity and the disability. As you can see, they don't expire with PSH, which, you know, requires a little bit extra work to attain, and some additional forms that we'll go through in just a little bit. But yes, so the main difference between PSH and PH is the chronicity and the disability. Next one, please. One, please. And so this is a disability certification for PSH programs. Again, this one does not expire. And something really important to note about the disability certification is that there are two different sections. You do not have to complete both. In fact, you should complete just the one. And for section 1, it can be completed by any homeless service provider. This will need with an attachment such as an SSI or SSDI letter or receipt of disability. So that will need to be attached to this form. And then please make sure to check that little box up here. And once you can fill up that section 1, you should be fine. Now, if you are completing section 2 instead, you wouldn't worry about completing section 1. That would actually be left blank. And this section can only be completed by licensed professionals. You must check that box up here to basically certify. And then very, very important, because we do require someone to be a licensed professional to certify this form. We really need to have that license number here. You can see it on that last little arrow at the end. All right. And so this is a chronic homelessness certification. Again, this one does not expire, and it's very important to fill it out completely because it has a couple of different boxes that you need to check. So for chronic homelessness history, it can be verified in a couple of different ways. As you know, we need 12 months of verified homelessness, and this can be done in the form of an HMIS program verification, a third-party homeless history form, an agency or third-party letter, client self-certification. Again, this one is only up to 3 months or 90 days. And then please indicate the types of verification used for chronicity and disability. So that is the most important part of this form. This really, for you as a provider, when you are getting your clients ready for PSH, this form really should only be completed as your checklist at the end to ensure that this client is in fact document ready, because you should have the disability certification form, which will come in the form of one of the two. So if you see these little boxes in the end, it says select one. It will either be, it will ask you for the section 1 or section 2. So if you completed section 1, you will need the written verification from SSI or something comparable. Or if you did section 2, then you will need that form to be signed by the licensed professional. Now, for the chronic homeless history, this can be in a variety of different ways. Like we've mentioned, there's a lot of flexibility in the way that you and the client can verify those 12 months of homelessness. You can use a mix of these 4 here. It could be perhaps just the one. So it will look different for every client. And we have different pathways of verifying to ensure that we can remove as many barriers as possible. And we'll talk about the HMIS, we'll talk about the HMIS printout in just a little bit and what that looks like. But yes, so here is another really important thing to note. I have checked off the chronic homeless documents, and it has an initial here. This is your, as a provider, certification that you in fact have the disability form, that you have that attachment that goes with it, or it's fully completed on section 2, and that you are also including some sort of document that will verify the 12 months of homelessness. Again, this should be kind of like the last form that verifies that you have those things. I think this could be one of the forms that is most easily mistaken, or there might be a couple more mistakes on this one, just for the fact of perhaps just forgetting to select the box, or forgetting to attach the documents that go with that section 1. and then the 12 months of verified homelessness. Okay. And then we'll talk a lot more about the flexibility that you guys will have for helping your clients with that. So we look at up to 3 years of homeless history. It's 2023 now, and that's looking at 2020 now, I believe. So 3 years back from whatever they were looking at. Today's the 12th, so 3 years back from October 12th. And they have to have experienced homelessness category 1 or 4 continuously for at least 12 months, or at least in 4 occasions within the last 3 years. This can be where the combined occasions total at least 12 months. Yes, sorry. So up to 4 occasions within the last 3 years that add up to 12 months. So the occasions must be separated by a break at least for at least 7 nights. Stays in an institution of fewer than 90 days count towards homeless history and do not constitute a break. Or an individual who has been residing at an institutional care facility for fewer than 90 days and meet chronic status prior to admission to institutional care facilities. That was a lot. That was a lot to say, but all of that to say is that if the individual was residing in some sort of hospital or care facility and it's been less than 90 days, they will still meet that chronic status. Now, if the client was there for longer than 90 days, then that will count as a housed occasion. And Shaitra might be able to correct me if I confused anyone with that, but
absolutely correct.
Okay, perfect. That one can be a little bit confusing just because of the institution. But if you do have a client that finds themselves in that situation and you're confused whether that counts or not, you can always send us an email to the referral email, the general referral email, or come to office hours and ask those wonderful questions. Okay. Also, this can be verified in the written observation of an outreach intake worker, community member, or housing or service provider or housing or service provider of encounters with the individual or head of household that includes a description of the conditions where the individual or head of household was living or is currently living. All of that to say, written observation from a provider in the community who has witnessed the client's living experience, and they can provide us with a written letter. Something important to note as well, 1 day of experiencing homelessness within 1 month will be counted towards the whole month. Meaning if a client has experienced homelessness 1 day of the month, for every month in January until April, that is 4 months of experienced homelessness. It is also considered 4 separate episodes of homelessness. I know the numbers can be a little bit confusing. So if anyone has any questions about that, we can clarify a little bit more at the end. And another very important thing for the verification is that family or friends cannot count as a third party. This needs to come from a provider in the community like yourselves. This is the third party verification form. This is just one of the ways that we can or you can verify the 12 months. It's the most commonly used, but you don't have to have this form if you're using any other of the other avenues. But something important to note here is that the client must provide permission before you can request third-party verification. And it's very important that the client signs and dates here in the top of the form. It's important that the agency providing the verification that they have experience firsthand the client experienced homelessness. I'm sorry, that sounded weird. It is important that the agency experience and witness firsthand the client's homelessness so they can verify this. And of course, once you receive this, your signature. Okay, this is also part of that form that we just looked at, but just zooming into the bulk of it. So this is what the providers will fill out. This is one of the instances. You'll put the start date and then the end date as well. Even if it's still current or it's today's date, it's better to put an end date than to just put current. Again, just because the forms don't expire, it's important for us to see this. The location as where could be a specific address, could be just a general location of where the client was seen, and then check what applies here. So that Verify would check that here. Were they receiving services? Was it that perhaps they just witnessed the homelessness firsthand? So the provider will check what is appropriate here. If let's say in one instance, the 12 months can be verified, that would be okay. But if maybe there was a break, then you might need to do a second instance and add those dates too. Again, the goal is to have 4 instances that add up to 12 months of homelessness, or to have those 12 months of continuous homelessness within the last 3 years. This is actually my favorite one, and I think it's a very valuable resource for all providers to use. But this is another wonderful way that you can hopefully verify 12 months of homelessness for your clients. If there is enough, if there has been enough HMIS contact, if they're in HMIS, you can assume that most likely the client was experiencing homelessness at some point, so they will have that track record there. Basically, what this report will do, well, to get to this report, you will go to the client's profile, go up to the right hand here where you see the little printer, and then you'll click on there, which will take you to this wonderful page. If you go to the very bottom, I know it's a little intimidating with all the other ones, but it'll tell you exactly what it does, is a homeless status timeline, and you want to run that report. From there, it will prompt you out to this page or this window, which is asking you what is the term that you're looking for. So you want to put within the last 3 years. You enter the range, so you should start the first day of the month, and then within the 3 years of the current month, and then the end date should be the current date. From there, you can do web or you can do PDF. I prefer PDF. It's easier for doc readiness, for doc purposes. You'll click submit, and it will take a little bit of time to generate, anywhere from like, I don't know, maybe 3 minutes or so. And then this will pop up and you'll have this wonderful report here. So you can see all of the green boxes with a yes, that is a verified month of homelessness. And it doesn't say it here, but there's also a key that shows up with this report once you get the full report that also helps you read it better. So sometimes there's some blue boxes, sometimes there's, like if you see here, green boxes with no Y's, and there's question marks. But very important, if you see green boxes and you can count 12 of them, that's enough to verify those 12 months, as long as it's within those 3 years, like we mentioned. This is a self-certification of homelessness. The client is able to self-certify for, again, up to 3 months or 90 days, very important. And it can be within the last 3 years. What this does, or what this allows a client to do is, perhaps, let's say, maybe in HMIS, there is 9 months of verified homelessness, but it took maybe 3 months. The client was homeless 3 months beforehand. They could still certify up to those 3 months, and that will help them reach that 12 months of verified history. This is just an additional tool that we can give our providers and our clients to, again, eliminate any barriers that might have happened due to lack of contact with the provider. Because there's a lot of clients out there that are navigating homelessness and are not yet connected. So they may not have anyone that can verify that or maybe witness it. So this is just another tool for you. Again, very important, don't forget to okay, this is the homeless certification that we keep telling you guys 90 days expires after 90 days. Please fill out everything. This form is very important. It's right here. If you see the very top of it, there's a couple of different boxes that will go along with it. So just check whatever box will be appropriate for your client. And make sure you are sorry, it's a little bit small there. I was trying to read them for you. So it could be anywhere like a firsthand observation, HMIS progress report. Maybe they're exiting the institution, like I was explaining earlier. Maybe they're currently residing in an approved transitional housing program, or maybe they fit in our category 4 of homelessness. So you will check whatever box and boxes are appropriate, and don't forget to sign and provide with your information. Oh, and can we go back, Chaitra? This form I do want to highlight. This is a form that is required for all documentation. So PSH, PH, rapid rehousing, this is going to be your form. So very, very important. Thank you. Okay, and then lastly, I want to talk to you guys about our referral transparency. SSF solely prioritizes and coordinates referrals into a program with the provider attached to the assessment and the person of contact for the identified housing program or project. So referrals aren't guaranteed housing. This is basically a reservation for an opening within a housing program or project. The referred client must be approved through the housing program or project, or if SHRA, then they need to be approved by SHRA as well, in order for it to be considered a complete and successful referral. The provider and the client must follow up on the housing related appointments, applications, further intake processes for a program enrollment. Programs can deny ineligible referrals. In that case, the referral is denied. The case manager and the client will be notified. And the referral process isn't a quick or instant placement. This is a process that again consists of multiple steps. So preparing your clients for the potential opening, getting your client document ready. Basically, that's what that means to you. As you see, there's not very many openings. We're lacking a little bit in some openings, but ensuring that you can assist your clients to be ready to go when those openings come will really make a difference. But once an opening is created by the housing program, me or any referral specialist will identify and select clients from our priority list based on the prioritization schema that we previously discussed. After the referral is completed, there will be additional paperwork, applications, and background checks that can delay the enrollment and placement. The provider does not send the referral. We as a SEP, the referral specialist will send those referrals once the opening becomes available. Again, the outcome of the referral is a little bit out of our hands once it's made, just because There will be intake appointments, there will be applications, there will be, depending on the program, it could be, income verification, and things along those lines. So again, referrals do not guarantee housing. It is just a reservation for the opening. And after that, it will be up to you and your client, to follow up with that procedure. Here are some additional resources. There's a provider resource directory. There's a housing document ready list. And there are also, well, there is one already, the shelter assessment recording. That is an additional training that you can train yourself on to assist clients get into our shared shelter list, waitlist. If you have any questions, again, anything specific about any of the information that was discussed today, any specific questions about maybe what forms you might need to fill out for your client, you can always shoot us an email to our referrals at SAG Steps Forward. Melissa or I will be monitoring that email to make sure that you can get those answers. And like I mentioned before, we also have office hours on Wednesdays. Correct me if I'm wrong, every other Wednesday, Melissa, right? Not every Wednesday at 1 p.m.
Every Wednesday at 1 p.m. Yeah.
Every Wednesday at 1 p.m. You can come to our office hours and ask any other specific questions about that. And I believe that is the end of our presentation. And I'll pass it back to Shaitra.
Alrighty. Hi folks. So thank you so much for being here. So we went through the whole presentation. We tried to answer as many questions as we could in the chat. But this is also another opportunity for the Q&A part. So if you all have any more questions to ask, you're more than welcome to ask them here and we can answer them. Oh, so also Tanya had a question. So when programs like these are full, what is the alternative process or program that we can avoid placing families back in harm's way? So unfortunately, so it's all based off of housing inventory. So if we only have a certain amount of openings, that's all that SSF has. But as the providers and advocates for your clients, there are other resources that you're able to tap into. So I would definitely suggest going to other resources. I understand that there is a misconception that Sacramento Steps Forward is the one shop for all, but we only have a part of it, right? So there's other resources that you're able to tap into, or at least I hope you are able to. And then we also send out other resources that are not directly SSF, that are connected to other ones. So I would try to connect with that. So everything we're talking about today is more so just like how to get into our programs, but also understanding with the referral transparency that it is a process. All right. So I have one, however, I'm still confused on how they are separately considered for prioritization. Okay, so we were talking a little bit about the prioritization schema, right? So how we create our priority list. So initially it is chronicity, and chronicity, age of 65 or older, chronic health conditions, right? And then length of time homeless. So the question was, what is the difference between chronicity and length of time homeless? So chronicity is when you make 12 months or more, 12 months or more of homelessness and or 4 instances of homelessness within the last 3 years. And then the length of time homeless is simply the days of how long you've been homeless, right? And so how is this characterized differently in the prioritization list? So if you are chronic, you're automatically higher prioritized. And then you're highly prioritized already. And then if you're over the age of 65, you're even more higher prioritized, right? So out of our entire group of right, I have an entire by name list of 10,000 folks, right? Then how do we take that 10,000 folks and makes it smaller? And how do we prioritize these 10,000? It's based off of this, so chronicity. So if you're chronicity, yes, you go up higher on the list. you're going up on the list. If you're over the age of 65, you're going up on the list. If you have chronic health conditions, you're even higher on the list. And then the length of time homeless kind of works as the tiebreaker in that situation, right? So someone can be all three of those, and then now the length of time homeless is going to even more affect where that person lands. So if someone only has 402 days, and then someone else has 406 days, now that 406 days person is now going to be higher prioritized compared to the 402 days person. So think of the length of time homeless as the tiebreaker, and or if people don't have all three of those, then the length of time homeless again affects where that person may land on a priority list. Let's see. So we did not talk about the CalAIM program. That's not what this meeting was about, but there will be some CalAIM workshops coming up soon enough, so be on the lookout for that. Can we have a meeting where we cover the other alternatives? That way we can increase our understanding and not just bank on your team. I mean, that'd be a great idea. So there is something called the Frontline Collaborative, and this is hosted by SSF, and this kind of came out of that idea as well of folks wanting more resources, right? Or more instances to be able to like connect with other programs and organizations. So the Frontline Collaborative is hosted by Sacramento Steps Forward, but we are reaching out to other organizations to kind of present about their program that affects our population, right? So they recently did one about the Medi-Cal team, and like, how does Medi-Cal work, and how do you get your clients into Medi-Cal, and what does it offer, and what other housing opportunities or income assistance that can be added to that. They also kind of cover a little bit about the shelter system. So these are monthly meetings. Sometime every other month, they alternate between in-person meetings and Zoom meetings. So if you can't make it, you can also go to in-person ones. And then all the slides and presentation material is also given to you or given to that group at the end. So that is definitely like one way that SSF is trying to do that. And if you have suggestions, you can definitely connect with the Frontline Collaborative folks. So this would be, I want to say, Teresa Bible and Tanisha from Sacramento Steps Forward, and they're completely open to like allowing the floor for folks to be able to have that space to share those resources. Okay, can you email me the recording? So yes, the recording of this today will be sent out to all of our CC groups. So if you're in our CC groups, we'll be sending it to you, and then it'll also be shareable from that email if someone else sends it to you. Totally okay, along with the slides as well. Okay, I see I have a hand. Where is the hand? Okay, I don't know where that hand is. Okay. Okay, any more questions? You can do this in the chat, and you can also do this in the question and answer section.
I'm typing in the question and answer section, just so you guys know. Under answers or answered, there's a lot of answers.
Okay. All right, are there any more questions? And I guess I also want to make one clarification as well. So when we talk about the word referrals, right? The only time a referral happens is when the SSF referral specialist confirms a referral with you in SSF. So sometimes our providers would be like, oh, well, I put in a referral for so-and-so for this program. That's not how that works, right? So the provider is simply requesting, right, a preference of where they would like to be. or where they would like their client to be in, or they're requesting to put that client somewhere, the provider is never making the referral. The referral specialist is the only one that's ever referring anything. So I think that's usually like a confusing part of like, well, I put in a referral. Unless an SSF staff directly put the referral in, that is the only time a referral has happened. Anytime before that, you are requesting a referral or you are preparing for a referral. Okay. Sorry. Okay, I have a question about the eviction notice being acceptable documentation for rental assistance. Why is the 3-day not acceptable anymore? It feels like we are putting our folks at further risk requiring court paperwork. I am unsure about that part. I think that's more of a PSAP question. Do you know, Talzine?
I don't. I know that just it was a new change at the end of August on documentation standards, but yes, this would be more of a PSAP and problem solving questions. Sarah Schwartz or Stacy will have a better answer for those programs.
But I do understand. Yeah, it would be putting folks at further risk because of the added time. So, but I think that's something that's good to bring up to Stacy and them, as that is their wheelhouse. As you saw in the presentation, we kind of skipped over the diversion part because our team doesn't actually handle the diversion section. We only handle the permanent housing section. Okay, I will stay on for one more minute if there's any more questions. Yeah. All right. I submitted a referral to United Way for CalAIM, and I was sent a homeless certification on the corner, has Sacramento steps forward. I was a little confused. So there are some CalAIM funds through SSF. But as you know, CalAIM is like through mental health providers mainly. So there are a bunch of different CalAIM satellites that are all over the state. So that could be a reason why you saw a Sacramento Steps Forward logo. But yeah, and also our homeless certification is HUD binding, so that's also could be another reason why you saw it. And it also is nice just to have all of the same documentation in one place. So that's always nice, and it's a great way to also keep track of clients of how they are going through the system. You're welcome. Okay. All right. If there are no more questions, I think we can end this training.
Thank you all.
Yeah. Again, if you have any questions, you're more than welcome to email the referrals at sacsteps.org, and we'll be able to answer your questions via email. So yeah, feel free to use this as a resource if you need. And if you have any questions, we're here. Okay.
Have a great day.
Thank
Thank
you.
Bye, everyone. Have a great
Bye,
day.
everybody.